Hi, I am Dr. Jocelyn, and today I want to clear up a stubborn myth that keeps far too many men trapped in frustration. The idea that an enlarged prostate is a one-way street and that once your urinary comfort changes, your best years are automatically behind you. That story sounds logical, but it's incomplete. Because what most men feel day to day isn't only about prostate size on a scan, it's also about pressure, swelling, bladder irritation, pelvic tension, inflammation, hydration timing, and something no one ever talks about, the way you breathe and brace when you use the bathroom. And that last piece is exactly where this video helps. I'm going to share a simple 30-second habit you can do right where you already are that can noticeably improve flow, reduce that not fully empty feeling, and calm nighttime urgency for many men. Often faster than you'd expect because it changes the mechanics that keep the entire area irritated. But I need to say something important right away. When people hear a bold phrase like shrinks your prostate fast, they picture a miracle transformation in a weekend. Real bodies don't work like that. Prostate tissue changes slowly, but swelling and congestion can shift much sooner. Muscle tension can change in minutes. Bladder signaling can calm in days. Residual urine can drop quickly when the mechanics improve. So when I say this habit shrinks the problem, I'm talking about what most men actually want. Less pressure, less urgency, fewer night trips, and the feeling that your system is working with you again instead of against you. If you've been told you have BPH or you suspect it, you're not powerless. The system is trainable. Let's talk about the real problem most men live with, because it's not just one symptom. It's the whole package that slowly wears you down. You wake up at night and you're not even fully awake, yet you're walking to the bathroom again. Sometimes twice, sometimes 4 times. You start living in fragments of sleep. Your mornings feel heavy, like you never fully recovered. You notice your stream isn't what it used to be, so you wait longer, you push more, you tense more. You get that annoying sensation that you're done, but not really done. You sit back down in the living room, and 5 minutes later, your bladder says, go again. Then there's the confidence piece nobody wants to talk about out loud. The quiet worry when you're away from home, the long car ride, the restaurant, the plane, the meeting, the fear of not finding a restroom quickly, that constant background tension, always scanning, always planning, becomes its own kind of stress. Here's the twist. That stress feeds the cycle. When your nervous system is on edge, your pelvic floor tends to tighten, your breathing becomes shallow, your abdomen braces, and you start urinating with pressure instead of release. This is one of the most overlooked drivers of urinary discomfort in men over 50. You can have a prostate that's only moderately enlarged, but a pelvic floor that's locked up like a fist, and the combination feels far worse than the scan suggests. That's why some men with mild enlargement feel miserable, while others with a bigger measurement function surprisingly well. It's not just anatomy, it's mechanics and signals. And that is exactly what we're going to change. So what is the 30-second habit? I call it the long exhale release plus double empty routine. It has 2 phases. First, you downshift your nervous system with a specific exhale that relaxes the outlet. Second, you give your bladder a short pause and a second chance to empty without straining. It sounds almost too simple, but it works because it targets what actually creates residual urine and irritation, tension, and rushed emptying. Here is exactly how to do it. Next time you go to the bathroom before you start urinating, take 1 slow inhale through your nose for about 4 seconds. Nothing dramatic, just enough to fill your lower ribs. Then do a long, controlled exhale through your mouth for 6 to 8 seconds, like you're gently fogging a mirror. While you exhale, soften your jaw. Drop your shoulders. Let your belly be easy. And here's the key. Imagine the base of your pelvis melting downward, like an elevator gently descending 1 floor. You are not pushing. You're not bearing down. You're not helping it. You're giving your outlet permission to open. That long exhale is the first half of the habit. And it's the part most men have never tried. Many men unconsciously hold their breath and brace as soon as they approach the toilet, especially if flow has been weak. That bracing is the exact opposite of what you want. If you want a smoother stream, you need relaxation at the outlet and steady pressure from the bladder itself, not force from your abdomen. Now you begin urinating, keeping your face, shoulders, and belly relaxed. No pushing, no rushing. Let it start when it starts. If you're standing, keep your knees soft and your weight balanced. If you're open to it, and many urologists quietly agree this can help, try sitting sometimes. Sitting can reduce pelvic floor gripping and help many men empty more fully because the body isn't bracing for balance. This is not about masculinity. This is about mechanics. When you finish, here's what most men do. They zip up immediately, walk away, and then wonder why they feel the urge again. Instead, stay there. Count to 10 slowly. During that 10 seconds, do one more long exhale. Again, 6 to 8 seconds. And repeat that same melting downward feeling at the base of the pelvis. Then wait and see if a second small stream happens. Often it does. Sometimes it's just a little. Sometimes it's surprisingly significant. That second release is the double empty, and that's the second half of the habit. That entire sequence can take about 30 seconds longer than your normal routine, but it can change your day because it reduces residual urine, the leftover amount that irritates the bladder and keeps signaling urgency. Less leftover means fewer repeat trips, especially that maddening 5 minutes later trip. It can also reduce nighttime wake-ups because many men go to bed with a bladder that wasn't fully emptied. Then the bladder becomes irritable and calls them up again. Now let's talk about why this helps the prostate conversation specifically. The prostate sits in a strategic location around the urethra. When the area is irritated, inflamed, or congested, the system becomes sensitive. Straining and pushing increase pressure in the pelvic region. Repeated pressure can worsen irritation and contribute to that swollen, tight feeling. When you switch from straining to releasing, you reduce mechanical stress. When you reduce stress, the tissues calm. When tissues calm, swelling can gradually reduce. And while this doesn't replace medical care, it often makes everything else you're doing work better. Hydration, walking, nutrition, even prescribed treatment, because you're no longer fighting your own body every time you go. There's another hidden benefit. This habit retrains the bladder-brain connection. Urinary urgency is not only a plumbing issue, it's also a signaling issue. The bladder has sensory nerves that send messages to the brain, and those messages get louder when the bladder is irritated, when you're stressed, when you're sleep-deprived, and when there's residual urine left behind. A long exhale tells your nervous system, we're safe. Safety reduces urgency. Safety reduces spasm. Safety improves flow. Let me make this practical with the exact moments you'll notice change. Some men notice the stream starts more smoothly on day 1 because they stop bracing. That alone can feel like relief. Within a week, many men notice fewer, almost immediate return trips after they urinate because they're emptying more completely. Within 2 to 4 weeks, some men report fewer nighttime wake-ups, especially if they also adjust late fluids, caffeine timing, and constipation. Over a longer window, you may notice a calmer baseline. Less pressure, less tightness, less urgency in situations that used to trigger it. Now I want to address the common mistakes, because doing this incorrectly can turn it into just another trick you try once and abandon. Mistake number 1 is pushing during the exhale. The exhale is not a push, it is a release. If you feel your abdomen bearing down, soften it. Think, let go, not force out. Mistake number 2 is rushing. If you try to get it over with, your nervous system stays activated. The 10-second pause matters because it gives the bladder time to settle and release what's left. Mistake number 3 is turning it into a performance. You don't need perfect counts, you need the feeling. Long exhale, soft belly, relaxed outlet. then a short pause and a second gentle release. Mistake number 4 is ignoring constipation. This one is big. If your bowel is backed up, it can press on the bladder and worsen urinary symptoms. Many men focus only on the prostate and ignore the bowel. If you're constipated, your bladder will often act more urgent and more sensitive. So if you want this habit to work better, support daily bowel regularity with water, fiber, and movement. Mistake number 5 is doing everything right in the bathroom but sabotaging the system at night. If you drink large amounts of liquid late, especially alcohol, sweet drinks, or caffeinated tea, your bladder will keep filling. This habit improves mechanics, but it can't override non-stop late inflow. So let's strengthen the results with a few simple add-ons that don't repeat the same idea. Each one targets a different lever. First, walk for 10 minutes after your largest meal, not for weight loss, for circulation and glucose stability. When blood sugar swings, inflammation signals rise and urinary urgency can worsen. Gentle movement improves circulation and reduces pelvic congestion. Second, shift caffeine earlier. Many men swear they can handle coffee, then wonder why urgency hits later. Caffeine is a bladder irritant for a lot of people, and it's also a mild diuretic. If you love it, keep it. Just move it earlier in the day and watch what happens. Third, don't hover in stress. If you live in constant urgency anxiety, your pelvic floor is probably tense. Add one daily 2-minute breathing reset outside the bathroom. Inhale 4, exhale 6 to 8. Soften your belly, relax your jaw. Your bladder responds to your nervous system more than you realize. Fourth, support pelvic comfort with warmth. A warm shower on the lower abdomen and inner hips can help muscles release. This is not magic. It's physiology. Warmth signals relaxation and increases local blood flow. These small shifts create an environment where your body can actually respond. Now let me share a few short stories so you can see how this looks in real life. One man I'll call Daniel was 67 and had started planning his entire day around restrooms. Not because he was drinking excessively, but because he never felt empty. He was a pusher. He believed that if he didn't push, nothing would happen. When he tried the long exhale release, he felt silly at first. But within a few days, he noticed something surprising. The stream began without effort. Within 2 weeks, his 5 minutes later trips dropped. The biggest change wasn't just physical, it was mental. He stopped scanning every building for a bathroom the moment he walked in because the urgency stopped feeling unpredictable. Another man, Javier, was 72 and hated nighttime wake-ups more than anything. He didn't even mind the daytime symptoms as much, but the broken sleep made him feel older than he was. He started using the double empty routine before bed and once during the night if he woke up. He also moved his herbal tea earlier and reduced late sipping. Over the next month, he went from 3 wake-ups to 1 most nights. His energy returned. He didn't fix his age. He fixed his sleep. And that changed his whole outlook. Then there was Robert, 61, still working, always rushing. His problem wasn't that the bathroom was difficult. It was that he was always tense. He would go quickly, push, leave, and then feel the urge again during meetings. When he practiced the long exhale and began sitting at home when possible, he realized how tight he had been for years. The improvement he described wasn't just better emptying. He said, "It feels calmer down there." That sentence matters, because calm is often the missing ingredient. Now I want to be very clear. If you have warning signs like blood in your urine, fever, burning pain, sudden inability to urinate, unexplained weight loss, severe back pain, or rapidly worsening symptoms, don't rely on habits alone. Get checked, and if you're already on treatment, this habit can still be useful because it reduces strain and helps you work with your system. But you should coordinate care with a licensed clinician who knows your history. If you commit to this habit, here's the mindset that makes it stick. Treat it like brushing your teeth, not a challenge, not a hack. A basic hygiene for your nervous system and your pelvic outlet. Every time you go, you teach your body the same lesson. We release, we don't force. That lesson accumulates, and there's something quietly empowering about that, because a lot of men feel betrayed by their body in this season of life. They feel like they lost control. This habit gives you back a sense of influence, not by fighting harder, but by getting smarter. The body responds to cooperation. So tonight, or the very next time you go, do just this. Inhale gently for 4. Exhale slowly for 6 to 8 while relaxing your jaw and letting your pelvis drop. Urinate without pushing. Then wait 10 seconds. Exhale again. And let the second release happen if it wants to. That's it. 30 seconds. And if you do it consistently, you may be surprised how quickly your body rewards you. If you want, tell me in the comments which symptom bothers you the most. Nighttime trips, weak stream, urgency, or that incomplete empty feeling. And I'll tailor the next video to that specific struggle. And if this helped you, subscribe so you don't miss the next set of practical habits that support comfort, confidence, circulation, and vitality in the mature years. This video is for general educational purposes only and is not a substitute for personalized medical advice, diagnosis, or treatment. Always consult a licensed healthcare professional before making changes to your health routine, especially if you have symptoms, take medications, or have chronic conditions.